Good afternoon. First of all, I would like to give a special thanks to the organization for the invitation for me to speak at this such big conference in Oslo. It's my first time in Norway and in Oslo also. Well, what was proposed to me is not to teach how to sharpen a competencies profile, but I think I'm going to raise more questions about it, and at the end to present just a proposal of competencies profile. Just a brief introduction. I work in this NGO for development in Portugal, and it has three main areas of work. Services. We provide services mainly through outreach work to populations that are in vulnerable situations like prisoners, sex workers, drug users, people that are unemployed, children in foster institutions, for example. And also during our work, during the last 10 years, we at the beginning felt the need to think about what we were doing and if we were doing this job well. So we started at the early beginning to do some research about our interventions, to create more impact on our services, and also to reflect about the reality and the changes in these populations and in society. And more recently, we started working at the advocacy level, trying to promote change on policies at national and European level. So, first of all, outreach work is considered a key intervention on engaging with hidden and hard-to-reach populations. It is disseminated around the world. Although for outreach work, still there's a lack of common and general consensus on how to do outreach work. Still lacks a framework or guidelines to do this job better. Who are the outreach workers? How do outreach workers do their job? What is expected from outreach workers? If this the absence of this framework exists, this can have negative impacts and misinterpretations about how to do this outreach work. It is expected that outreach workers can engage and create empathic relationships with the populations they work with. It is expected they can negotiate with them. It is expected that they can create boundaries, that they can have responsive attitudes, they can respect their privacy, their rights, etc. But how to do this? Outreach workers, together with the populations they work with, they go unnoticed, invisible. So who are these strangers? What kind of skills do they have? Which challenge do they face? What differs their practices from other workers that work on health and social fields? What are their working conditions? What kind of career perspectives do they have? Working on the front line, they should be visible, but they work underground. As two Brazilian researchers talk about in an article, they say they work between marginality and citizenship. They enter underground territories, they meet unknown people, they deal with diverse and complex situations, and they one of the main objectives is that they can empower these people, they can fight for their rights. But how to do this if they sometimes are seen also by the society, by the communities, as they see themselves as a healthcare worker, but sometimes also in a condition of marginality, without any warranties of performing this job. To promote the empowerment of these populations, it is important also that these workers, outreach workers, feel empowered themselves, with job guarantees, with conditions to work that can also be given and supported by the organizations and by policies. They work also under systems, under heavy social, labor, health policies and frameworks that most of the times care little about outreach workers, about outreach work, and about the people they work with. Often they can be used as iron arms of these social health policies. Do outreach workers sense this? Do outreach workers know about this and can block this? How do they can block and create a barrier not to be these iron arms? Acknowledging this control and this pressure towards social control, they can still promote and empower the rights of the populations they work with. But how to do this again? Which kind of skills, which kind of competencies these outreach workers should have to have this kind of action? These systems don't recognize and invest properly on education and on labor conditions of the outreach workers. Outreach workers are themselves out of reach of these labor and education systems in most countries. Only limited training exists in the EU, in Europe, that focuses only on outreach work. This leads to a lack of coherent and consensual job profile. Training is done by the organizations on the job, and these workers work mainly through their perspective of outreach work, what is outreach work, or based on the perspective and vision of the organization. This can have strong and often negative impacts because outreach workers do not have the same vision, and we see lots of difference between organizations on how to do outreach work. What is outreach work? What should and shouldn't be done? Also, the labor system is far from recognizing the outreach workers. They aren't recognized most of the times, protected or supported. They work in suboptimal employment conditions. They have low salaries compared with other healthcare and social workers. They work unsocial hours out of a secure-based agency or office. They have limited autonomy and limited opportunities for career and for promotion. These conditions are really different from the mainstream jobs. They work in unsafe environments and semi-legal contexts. For example, they work outside. They work outside these organizations, outside of a secure office or with a seat behind a desk. They are unknown. What outreach workers, what are they made of? If I ask the outreach workers that are seated on this in front of me, could you explain how to do your job? I think it's a difficult question. I think it's a complex answer. It's a complex job. So what should be our focus to be recognized, to be more known, more in front line also? Not the only answer, of course, but if we can sharpen the professional profile of the outreach workers, this can give visibility about the job. And also coherence on this job, coherence on how to do outreach work. So which profile do outreach workers should have in terms of activities, in terms of competencies, which skills, attitudes, which knowledges, which training and which qualification, which professional recognition can we take out of this? Sometimes outreach workers are seen as generous workers, charitable, with a good heart, doing small talks with the populations and providing supplies. The personal and the values and the personal skills and attitudes are the core business of the outreach work. These are key competencies, although they should be better worked out in the outreach workers. We should work better these skills to do and to perform better this job with positive consequences on the populations, on policies, on outreach workers themselves. Outreach workers deal with unique situations and have to make decisions, and most of them, they have no clear and no immediate solution or response. It's easy to fall and adopt inappropriate approaches when such complex situations appear. So when someone asks us for support, outreach workers for support, it might be easier to think about charity instead of empowerment. How do outreach workers stop being, for example, having paternalistic responses to the populations? How do they empower them? How do they give them power? It might be safer to keep the same limits and follow the same tracks when a new situation comes up, even if the situation calls for innovative and flexible approaches. Also, when personal safety is at stake, outreach workers can feel more in control when they eliminate this threat, instead of protecting the rights of all and also their own. How to be responsive instead of punitive. How to do this. What contributes to the uniqueness of this job, of this work, also puts outreach workers in a certain high uncertainty and ambiguity. The settings they work in are complex, diverse, are multifaceted, and can create really difficulties to outreach workers to decide what's right and what's wrong. What should or shouldn't be done? To fully understand the outreach work, we should incorporate on the profile of the outreach workers principles of action, core activities, core skills, core attitudes, core knowledges. I'm going to show you a result from a project called Profile of the outreach workers in specific settings, in harm reduction settings. But what we did on this project, together with more 10 partners from 10 different countries, including Norway, and I can't say the name of your organization ever, so sorry about that, but you were involved. What we did, an American theorist, a psychologist said, if you want to test who will be a good policeman, go find out what a policeman does. So that was what we did in this profile project. So this is the result of the project. It's just a proposal that is based on literature review that talk about working standards. We did literature review on guidelines that talk about outreach work, how to do outreach work, etc. Several books about it. We also included on this, you can see on the methodology part that, sorry. We have an overview of the 11 countries involved on outreach work, on the training of the outreach workers, and also on employment conditions. On this chapter, you find David McClelland, the American psychologist theorist, and what we did was to make an auscultation process that involved around 170 participants from these 11 countries, that talked about their job, their challenges, their dilemmas, their bottlenecks, their what do they do in the field, and what they think they are the major challenges, the main attitudes, the main skills they should have. And we put this all together into this book and into this profile. So first we have the activities and some good practices examples, and for example, this core activity provides support, services, and refer service users to the local community network is one of the core activities that outreach workers do, provide or refer to HIV, HCV, HPV, etc., and provide general healthcare services. These are the activities. And then you can find the knowledges. You can download this. If you Google, I think you can easily find the ebook. You can also search for it on APDES website and also on other partners involved. And we also have core skills that these skills are the competencies that the outreach workers should have and are related to how to use some kind of instruments or some kind of how to do evaluation, for example. And then you have the attitude, sorry. This is still a proposal that should be improved. It's just think of a step to a discussion about the profile of the outreach workers, and most certainly needs to be improved and needs to evolve as outreach workers is also evolving. I can sing a little bit. So the most important thing, the last message I want to give you is that these frontline workers are important. They need to be recognized. We need to build and shed light on outreach workers' identity. We need to create identity, professional identity, a sense of belonging to a professional class. They have to feel, outreach workers have to feel they are a workforce, an important workforce, that they are not on the low hierarchy of the healthcare workers or social workers. They are most certainly in the high hierarchy. So they must be valued. They need to feel they have a place. They need to feel they have a secure and strong professional identity. And this can be a discussion through a profile, through training and qualification, through creating officially recognized. I know in Norway, outreach workers are pretty much recognized, but in most of the countries, this is not a reality. When I started working as an outreach worker, I started working 12 years ago in another field, and then I changed. I started working 7 years ago in outreach work and with people that use drugs. And a more experienced worker, a colleague and friend of mine, said to me, when she was on my first day, she was explaining, what should I do? And now I don't work as an outreach worker, but I remember this as an important message that she gave to me. She said, apparently you will only provide supplies. You will give syringes, you'll give food. But as the time continues, you will see this job, it's much more complex than just providing supplies or just going and through a van to an unknown territory. And she didn't say anything more to me in that time. So now I know this is a much more complex job and it needs to be valued. So thank you for listening, and I hope I can contribute a little bit. Okay.